rule. And instead think about, well, how does manual therapy as an adjunct provide windows of improvement that allow me to then utilize other interventions, mainly exercise, to elicit the adaptations that I want.
Yeah, I really like that, the way that you phrase that, windows of opportunity to be able to elicit the changes that you want.
Yes.
Because I think that's how you have to see it. And whether you're using it for pain modification or you're using it for performance, we understand that manual therapy in general is going to have some sort of transient effect.
Yeah.
But it's creating, as you said, that window of opportunity. That's what it's doing.
Well, we've talked about this a bit recently where, let's say you get someone from the general population coming in with low back pain, and they've got years, if not decades, of just detraining from doing nothing. And like one of the things we've been talking about recently is, what are the expectations we have for the basic physical capacities or requirements needed to minimize
I think,
an injury?
It's probably going to annoy people, but generally most people are pathetic.
It's true. Like, the reality is we live in a society now where the expectation...
It's acceptable to be pathetic physically.
I mean, I'm probably getting more controversial here, but I always find it interesting too of what people consider to be normal weight, for instance, these days. And it's interesting too, like, we work in an environment where we have some very high-level athletes who are quite lean, and they're always seen as the exception of, like, oh my God, you're too skinny, or like, that's not something that's healthy. And it's like, well, actually, it's just the response from doing long-term training. We got it better? Which, when you think about it historically, like, we were always participating in high levels of physical activity throughout most of human history. It's only recently where it's become an option to essentially do nothing. And I look at it the same with regards to people that present with back pain, and you realize that they just have such little physical capacity. I think we need to be a bit more critical and look at the bigger picture of, well, what are the big rocks? What are the major reasons for why this person's getting pain? Now, even in these situations, I do think manual therapy can be a useful adjunct, particularly in those early stages where I don't deny that they might have significant pain and that limits their physical ability. But unless you're thinking more of what are the stresses I need to apply to build up their physical capacity, and the other thing of that is what's the timeline for that, then you're going to be stuck in a very vicious circle where if all you're doing is manual therapy and you're not seeing improvement, then yeah, part of the problem there is you're not applying the appropriate treatment modalities. And this is where I think a lot of the research falls short, because they do these studies of, is manual therapy effective for low back pain? And you look at the population characteristics.
Yeah, and if you're sedentary and you have very low physical capacity,
correct,
and you haven't exercised in years, and you're overweight, and your metabolic health is poor, and you clearly probably have signs of major inflammatory, dysfunction.
Yep.
Applying some manual therapy is not going to have long-term beneficial effects. It's not going to modify the pathology that may be present, or even the pain presentation, to any significant degree.
And that's the reason why in professional sports or with elite athletes, you see manual therapy being utilized a lot, because they're ticking the major boxes already.
Yeah.
These are healthy people who participate in physical training on a regular basis, and they utilize manual therapy to support their system, both from a recovery standpoint by helping change their inflammatory status and also regulating their autonomic nervous system, to be able for them to continue repeated bouts of training. And that's probably the big thing here too, is it allows you to train more. And that's essentially how we look at it. And the way that we use it in a rehab setting is it allows you to train more by regulating the amount of nociception that you experience.
Mm. Yeah, I think this has highlighted a number of areas that are just, it's almost nonsensical to me that we're having a discussion about what value it has.
Mm.
Right? There's an overwhelming amount of evidence to support its utilization.
Mm.
Is it appropriate in every setting? No. But is it appropriate, or even is it an adjunct to the majority of settings? Yes, definitely. And in some cases, it may be the primary thing that maybe I would actually assist someone's recovery, because if pain is the major factor that's driving it, and all of those other health features are relatively well managed, as you said, say like in an athletic population, something like manual therapy may be the thing that allows you to get over that next step to change that nociception.
And the reason for that is how it regulates your hormetic profile, because